So my name is Alexandra Lutnick. I've been with RTI International for about 8 years now. I work in the Behavioral and Urban Health program, and I'm a senior research scientist with that program. Oh, it can vary. It seems like my work lately is really split. So a big portion of it focuses on the sex industry, inclusive of sex trafficking. And then there's also a portion of my work with the Women's Global Health Imperative Group in the San Francisco office that's looking at ways in which women can initiate HIV prevention in sub-Saharan Africa. Oh, well, I've been doing work around the sex industry for close to 2 decades now. And so it first started, I was working at a peer-based clinic for sex workers in San Francisco doing counseling and HIV, STI testing. And while I was working there, began to see a lot of the same sort of themes present themselves and realized we maybe weren't doing the best job at capturing that in a rigorous, methodical way, such that we could advocate for changes that could improve people's lived conditions. And that's when I started to venture into the world of research and did a study for 5 years looking at the impact of social capital on women who are involved in the sex industry, and also women's preferred regulatory frameworks. So at the time, this was back in the mid-2000s, so around 2004 to 2009 that the study took place. There was a ballot on an initiative on the ballot in Berkeley that would have begun the process of decriminalization of prostitution. And a critique that happens a lot is that it's typically white middle-class women who are advocating for that, and we don't always hear the voices of more marginalized individuals in the sex industry. And so we incorporated that aim into the study as well and asked about 350 women what they would prefer. And these were largely women who were marginally housed or homeless. Over half had substance use issues, and so they were truly those marginalized voices. And so that really got me hooked on research as a way of, this can respond to immediate needs and also be reflective of the needs of communities, so having it be truly participatory where peers are involved in all aspects of the research process. So after that study is when I transitioned to RTI International and was working on a study looking at women who use methamphetamine. So that's another area of the research I do, is folks who use illegal substances. And again, with that study, about half of the sample were trading sex, and realized this is a great opportunity to address one of the gaps in the literature, which is there's a bulk of publications saying that all women in the sex industry have symptomatology of sexual abuse trauma, and so being a part of the sex industry is inherently harmful. But those studies have never had comparison groups. And to me, this could be a reflection of the larger social setting in which women are existing, and it may not necessarily be because of sex trade involvement. And so we were able to run that analysis, since the sample was about evenly split, and realized, in fact, it was psychological dependence on methamphetamine and experiences of being raped as an adult that were driving the association. And so to me, that begs a very different social response and policy response, that it's not, if we get rid of the sex industry, this issue goes away. It's women are living in cultures, systems of violence, regardless of sex trade involvement. For me, the reason why I do this work is really wanting to ensure that the diversity of experiences that all people have in the sex industry, regardless of gender, are really represented. Because far too often we get this very narrow discourse or portrayal that doesn't represent the diversity. And if we're only relying on that one narrow portrayal, we end up with programs and policies that aren't actually helping and sometimes are actually hurting people. And so a lot of my more recent work has focused on young people's experiences in the sex industry. At the federal level, they're all considered victims of sex trafficking. And I'm sure you've seen probably in media here about the epidemic of sex trafficking and girls being forced into this against their will. And predominantly, that's still the narrative that we all hear. And I know, based on my earlier work, that it's not that simple. There's a diverse range of young people who are involved in the sex industry for a variety of reasons. Some are coupled with third parties who are exploitive, some are coupled with third parties who are really just peers helping each other survive, and some are doing it on their own. And where I think research is really helpful is to bring out those differences and to highlight the nuances and say, if we're trying to hold the diversity all together and not prioritize one narrative over the other, even though that story of a young girl forced against her will really hits our heartstrings and makes us want to do something, then we see that a lot of the policies that are coming out aren't really addressing the root causes. And perhaps they're creating collateral consequences where the young people themselves are being charged and end up with juvenile records. And or the key, most tangible things that they really need, such as housing or viable employment options, routinely go unfunded. And so being able to have the data of here are the diversity of young people and their experiences then allows for, I think, a really good critique of policies and programs and can hopefully push things in a direction that these young people's needs are being better met. Sure. So we have in California Proposition 35, which passed in 2012. It's also called the CASE Act. And what's interesting about that one is it was a voter-initiated piece of legislation. And it's pretty rare to put something on the ballot when the state assembly senators are already dealing with it. And so there was a ton of work happening at the state level around this, but a couple people still went ahead and put this on the ballot. And it passed by an overwhelming majority, which to me is not surprising, because if we see something that says we're going to increase penalties against sex traffickers, of course we're going to say yes to that. Nobody is for trafficking. No one's for exploitation. But really what this act does is focus its attention on perpetrators, and it's this rational approach to deviance. So it raised the penalties associated with trafficking a minor by a number of years. So let's say before it was maybe 4 to 8 years, now it's 8 to 12. But we know through research and through history that this rational approach to deviance, if we just make the penalties severe enough, the issue will go away, doesn't work. I mean, we can look to the war on drugs to see that. And it actually does nothing to equip young people with alternative options. So if a young person is homeless for whatever reason, maybe they've left home because of abuse, been pushed out of home because of homophobia or transphobia, or are just drawn to a more transient lifestyle, they need a way to survive. And so because they're minors, under the age of 18, very few have high school degrees or GEDs, limited to no legal work experience, and so it's hard to get legal employment. And so then to survive, they're trading sex. Making penalties higher for people who are third parties does nothing to address why trading sex is their only least worst or best option. What Proposition 35 also did was increase criminal fines up to $1 million for people convicted. And so those funds that are collected through criminal proceedings go to Victim Witness Assistance Fund. And basically that funds law enforcement and social service providers. So if a young person has been exploited and they wanted to receive any financial compensation for it, they have to wait for a civil proceeding, at which case criminal proceeding has already happened, and there's probably no money left because they've now increased those fines tremendously. So again, nothing's actually directly benefiting the young person who's involved. The other piece of it that was problematic, there was a couple more. One, it created a 2-hour mandated training for law enforcement. In general, training is really important, and I would agree with that. And training is only as good as its content. So I had the opportunity to view this 2-hour training, and it presents a very simplistic idea of what's happening. So it's all young cisgender women who are scantily clad, who have a third party who's a person of color exploiting them. And then the police find them and say, you're safe with us, you're a victim, you can trust us, and then they open up and tell them everything. To me, that's not, that doesn't reflect reality. And it also doesn't provide law enforcement officers with tools to deal with LGBTQ young people, cisgender boys, young people who don't have somebody exploiting them, young people who don't want to tell them anything. And so there's a possibility that it can create more harms than good because it's not really equipping law enforcement with the appropriate awareness of what this social issue is. It's with Columbia University Press and is called Domestic Minor Sex Trafficking Beyond Victims and Villains. And so it's really exciting. The work started off actually at a project here at RTI. We were doing a process evaluation of 3 programs who were funded to work with domestic minor victims of human trafficking. It was the SAGE project in San Francisco, the Stop It program in Chicago, the Street Work program in New York. And at the time I was doing my Ph.D. and thought this would be a great opportunity to carve out a piece for my dissertation. And so what I built into that process evaluation was doing semi-annual case history narratives with case managers. So they would profile 5 of the young people whom they were serving, and then on subsequent visits was able to get updates. And so this overcame the challenge of being able to stay in contact with a young person as someone not working at the agency. If I was just flying in, the possibility of scheduling things, it can be really challenging, as well as potentially the young person wouldn't necessarily trust me. They don't know me from anybody. The limitation, of course, is it's the voices of case managers and not the young people. But learned a lot from that data about routes and reasons into the sex industry, the ways in which young people's lives are linked to others really shape their opportunities and constraints and can influence whether they enter the industry, how long they stay in, how they get out, but also the challenges that case managers experience working individually with these young people, working collaboratively with other agencies, and then the restrictions they experience based on these macro level challenges related to policies. So it was really interesting work, and as I've been speaking about during this interview, really highlighted the diversity of young people, and there's not a one-size-fits-all approach to how we should respond or what these young people's experiences are like. And then for the book, expanded the scope of it, so conducted more interviews with people who had experienced sex trafficking as a young person, other key experts. And then although a lot of people will say nobody's talking about this, if you're actually looking for it or paying attention, a lot of people are talking about it. And so went to a number of conferences where people were presenting based on that and incorporated all of that into the book as well. Absolutely. And it can be way too stigmatizing. And so when you talk to young people, and this comes up in the book a lot, it is very rare for them to think of themselves as victims, especially while they're in the experience. Some of them afterwards will think of them that way. Some will think of themselves as survivors. Some won't put a label to it at all. But in general, young people feel like they're doing what they have to do to meet their needs and to survive. And so that's very different than what we get through mainstream media and warrants a very different response. And so if all we focus on is ratcheting up penalties for third parties and for exploiters and clients, nothing's being done to address the structural factors that make it such that young people feel this is their only option, or in situations where someone takes advantage of what's going on for them and coerces them into doing this. So what we really need is peer involvement. And in general, people who have been in the sex industry by choice, circumstances, coercion, aren't at the table, influencing what policies are being created, what programs are being developed, how the programs should be implemented. And without their voices, it's a key gap. And so I think there's beginning to be a trend moving in that direction. For example, I just got an award through the National Institute of Justice to do a peer-based evaluation of anti-trafficking task forces in San Francisco. And so my co-PI will be Min Dang, who's a woman who experienced sex trafficking as a minor. We're hiring 2 research assistants who have experienced trafficking in some capacity, and we have an entire community advisory board. And so it's figuring out the ways in which people who have had these life experiences can be the ones producing the knowledge and really guiding the field, I think is very important. I also think it's going to, within the next 5 years, 10 years, what I'd like to see, explore different responses where a criminal justice response isn't the one that's prioritized. And the reason for that, specifically around trafficking, is it prioritizes prosecution and law enforcement and not really the rights of the individual who's experienced exploitation. And so many of those people don't want to pursue legal action. And so we need to think about what are the resources and support that they really need and be okay with the fact that sometimes that's not going to involve building a case against a third-party person. And that for a lot of these people, be them young people involved in the sex industry, adults who are being exploited in any labor sector, including the sex industry, they haven't always had positive experiences with law enforcement. And sometimes the ways in which trying to build a case plays out, it can feel as exploitive as what they were experiencing. So it's, if you give us this information, we'll let you off. And that's really problematic and recreates the trauma that people have experienced. I would also say what we really need to do, especially for young people, is it's inconsistent to say at the federal level they're all victims. Whether there's force, fraud, or coercion, movement across state lines, doesn't matter. If they're under the age of 18 and trading sex, they're a victim. But it's states that regulate prostitution laws, and very few states have minimum age requirements. And so what we need to do is either put in a minimum age requirement or decriminalize young people's involvement. So really no young person should be arrested for this. And to think about the ways in which those adults who are in the sex industry could be allies. So in general, those might be the people who are seeing exploitation happen and are in a position that they could report it, but for fear of being arrested for their own involvement in illegal behaviors, it prevents them from going to law enforcement. And so we can look to India, where there's a group of 65,000 sex workers who are organized. And what they've done is said, we want to make it a priority that no young person is working in the red light districts or adults who are being forced. And so they have a regulatory board that screens everybody who's coming into this area. And they've been more effective at identifying young people than the police have been. And so to me, that really highlights the ways in which advocating and utilizing peer involvement can really help address some of these issues that are happening. So to effectively address any social issue, be it someone's involvement in the sex industry by choice, circumstance, coercion, be it substance use, we need to understand all the factors that happened before they even started these behaviors. Because oftentimes it's very rational. And if we can understand that, then we can offer a more human rights-based approach that allow people to maintain their dignity and their agency and have self-determination and can help guide what they want to see happen. And for some people, that's going to be, I want to get out of the sex industry, but I need viable employment options. For some substance users, I want to stop, so I'll go into drug treatment. But for others, they're going to say, oh, I want to keep using. It's like, okay, well, how can you do this safer? We don't want to see you harmed. We don't want your loved ones harmed. And that's true for substance use. It's true for the sex industry as well.